Hi guys, in this video we're going to be talking about rhesus factor incompatibility. So when you're checking your genotype and your blood group, please, you need to check your rhesus factor as well. You need to check if you have rhesus factor or not. It is either you have it or you don't have it. But remember, it is not a disease. Oh, yes. It is not a disease. It is just an extra thing that is attached to your blood. It won't stop you from getting married to whosoever you want to get married to. It's not like genotype that you have to be careful of who you get married to. So if you have rhesus factor, you are rhesus factor positive. Did you understand? And again, if you don't have rhesus factor, you are rhesus factor negative. And again, if you and your husband have rhesus factor, there won't be any problem. Oh, yes. And again, if both of you do not have this rhesus factor, there will not be any problem. If a woman have this rhesus factor and the husband does not have it, there won't be any problem. So where the problem comes in is when a woman who is pregnant doesn't have rhesus factor and the husband that she is pregnant for has rhesus factor. That is, he is rhesus factor positive and the woman that is pregnant is rhesus factor negative. So there is possibility that the baby that is going inside the womb of this mother that is rhesus factor negative would carry the blood of the father that is rhesus factor positive. So if the baby, continue growing in that womb, the baby will be exchanging things with the mother, the blood and everything. So the blood of the mother will then dictate that the fetus in the womb have something that they don't have. So now, and the body of the mother will start releasing or producing antibodies to fight what is in the baby's blood. Did you understand? The funny thing is that as a pregnant woman, you will not notice this. You will still carry your baby to term and give birth to your baby normally. Remember that your body has developed antibodies while you're pregnant against the rhesus factor in the blood of your baby when the baby was in the womb. And again, remember that these antibodies, they think that the rhesus factor in the baby's blood was a danger, when the baby was in the womb, and they fought it. So after having your baby, remember that those antibodies are still in your body. So there is a medication that you're supposed to take to cleanse your body of these antibodies. If not, from the next pregnancy, they will start fighting it again. So remember that during your first pregnancy, it might be normal and you carry to term and you have the baby. Remember, the baby has rhesus factor positive. So if you don't treat yourself with this medication, which I'm not happy to mention here, you're supposed to be speaking to your doctors as they know how to help you. So if you don't treat yourself, it may result in you having miscarriages from the next pregnancy, or the baby will die after you had the baby. So this is because the red blood cell of the baby was fought, and destroyed by these antibodies. So rhesus factor can cause you tears if you don't know about it. So it's very important that you check your blood and make sure that if you're negative and your husband is positive, you know what to do. So make sure that you know about this rhesus factor and the medication you should take after delivery. That is, if you are a woman and you're pregnant and you are rhesus factor negative and your husband is rhesus factor positive. So this medication, you're supposed to be taking it around when you are 28 weeks pregnant. Then after your delivery, you have another dose. The medication may vary depending on your location or where you reside. Normally, this advice will be valuable for people living in Africa, because in Western world, they would automatically dictate it when a woman is pregnant and the woman is invited to come for blood tests and will be sorted. However, if this video is for you, do not do self-medication. You must make sure you consult your doctors and follow instruction from your doctor. So Now, once you take this injection, it means you are ready for another pregnancy, and you keep on doing it until you have the number of children that you want to have. I hope this video interests you. Please give me a like and share it so others can see. It's still your favorite nurse. Thank you.